Mabrokarder is one of the 16 villages combined to form the Malambe area located in the Western Area Rural District of Sierra Leone, which has Waterloo as its capital for local government authorities. The entire Malambe area has a population of 12,000, and 800 of those are inhabitants of Mabrokarder. This western settlement has a large expanse of flat land and is interlocked with very rich inland valley swamps, making it easy for the development of large-scale market gardening. These endowed resources had influenced a greater percentage of the population to be engaged in profitable, self-employed agricultural activities. As a result of the keen economic potential, these communities possess a lot of people of diverse economic interests. The populations are mostly youthful and are determined to make a difference in their socio-economic status. Sadly, though, the socio-economic activities of these people and that of the entire country of Sierra Leone came to a halt due to the outbreak of the deadly Ebola virus in 2014. As a result of this tragedy, education came to a standstill and businesses crumbled as people's movements were restricted by the government to avoid the spread of the virus during that time. After the virus was contained in 2015-2016, many of the inhabitants in Mabrokarder were not able to recover their loss and are left in abject poverty to this day. Education and healthcare, especially for women and children, are a great challenge for these communities. There is only one government primary school located in another community, which is a few kilometers from Mabrokarder. The nearest secondary school is about 7 kilometers away. Students would have to walk on foot each day to and from school. This challenge has led to a high rate of dropout of boys and girls from schools. Many of the older students have gone into small-scale backyard gardening to help support their families since they cannot continue to pursue higher education because of the lack of funding. Providing healthcare services for these communities will bring relief for many families. Because of snake bites, a lot of money is spent taking infected loved ones to hospitals, the nearest one being 20 kilometers from Mabrokarder. The hospital's location allows it to serve as the mini capital that connects the rest of the village in the Malambe area. There are reports of people dying of snake bites while working on their daily agricultural activities due to a lack of emergency medical aid. Furthermore, pregnant women often suffer during delivery from the hands of traditional birth attendants. The World Changing Center is a 501c3 charity organization that is based in the United Kingdom under registration number 1136070. WCC adopts a philosophy which considers education, schooling, skills training, and knowledge acquisition, along with healthcare, to be the main pillars of any society aiming for revitalization and prosperity. WCC aims to provide children and young people in Sierra Leone with improved quality of life and access to up-to-date educational services. Please donate today to support our current projects, the WCC Academy and WCC Health Center. The WCC Academy has been running successfully for 3 years, but without permanent premises, its future cannot be secured. Now, the second stage of our business plan is to construct a new 4-classroom school building so we can expand its capacity and provide an education for more than 100 children. The new school building will contain classrooms, a kitchen, and bathrooms using locally sourced sand, cement, and workers. The school will be equipped with educational resources that include but aren't limited to books, stationery, tables, chairs, and blackboards to aid in effective learning. We will also employ full-time teachers so that the quality of education is improved and becomes more sustainable through consistent delivery. As the school has a proven history of growth and support for the students, the future is dependent on the development of a physical building that will further the growth of the students, which in turn helps improve the living standards of the community. We also plan on offering extracurricular activities such as sports and field trips. Our drama and arts therapy programs support children with overcoming war-invoked trauma and with basic health and sanitation. WCC will help combat the child mortality rate and promote vital HIV/AIDS prevention through playing informative and fun activities. WCC has also taken the initiative to construct a healthcare center for pregnant women and newborns to overcome their healthcare challenges. We plan on building a 20-bed healthcare center next to the school on land purchased by the WCC. We will allocate funds to hire a construction team to construct those facilities and to purchase medical equipment. Furthermore, we will hire 1 doctor and 5 nurses for the center. Funds will also be needed to provide essential training and to equip those who will work in the center so that they may maintain the center and make a positive impact on the disease and child mortality rates. Please donate today on our website to help out with our mission of providing better healthcare and education for the communities in Sierra Leone.